We've all got a box of these kicking around in a drawer somewhere, but if you ever really stopped to think about the incredible science that's packed into a simple bandage? Well, today we're going to peel back the layers on this everyday item, because it turns out that little piece of first aid advice you've probably heard your whole life might just be completely wrong. You know the drill, right? You get a little scrape, and someone, maybe your mom or your grandma, always chimes in with, "Oh, just let it breathe, let it air out." It sounds right, doesn't it? It feels like one of those timeless pieces of common sense. But is it really the best thing to do? Let's find out what the science actually says. Well, it turns out the answer is a big, resounding no. Modern medicine has totally flipped this idea on its head. The best way to heal a wound isn't to dry it out in the open air, but to do the exact opposite. You want to keep it moist and sealed. And there's a special kind of bandage that's the key to doing just that. So, let me introduce you to the hero of our story, the occlusive dressing. Now, I know the name sounds super technical, but the idea behind it is actually really simple. It's basically any dressing that creates a complete seal over your wound. Think of it like a tiny personal bodyguard for your injury. It locks out all the bad stuff like air, water, and germs, and it locks in your body's own amazing healing powers. Okay, this slide just lays it all out, plain and simple. Look at the left side. That's the old air it out method. It dries out the wound, which leads to a hard scab. And that scab, it actually slows down healing, and it can even increase your risk of infection and scarring. But now, look over on the right. Sealing the wound keeps it moist. This prevents those hard scabs from forming, which means your body can recover way faster, and you dramatically lower the risk of both infection and nasty scars. It's a total game changer. So, we get it. Sealing a wound is better. But why? What's the secret sauce that's happening underneath that bandage? Well, it's not magic. It's actually this really fascinating biological process that just needs the right environment to work. So let's break down exactly how sealing a wound supercharges the whole healing process. An occlusive dressing is so powerful because it's doing 4 crucial jobs all at once. First, it's a barrier, a perfect little shield keeping germs and water out. Simple enough. Second, it traps moisture. Think of it like creating a tiny greenhouse for your skin cells. It gives them that perfect humid environment to do their repair work super efficiently. Third, it helps with something called debridement, which is really just a fancy way of saying it lets your body self-clean. That trapped moisture helps gently clear away all the damaged stuff. And finally, there's comfort. Because you don't get that dry, tight scab, the wound hurts less, and changing the bandage is way less traumatic. And this isn't just about a little paper cut on your finger. This whole principle of sealed, moist healing is used all across the medical field, from minor oopsies at home all the way to life or death situations in the emergency room. For sure, you'll see these dressings used for everyday things, like minor burns or a scraped knee. Doctors also use them to protect surgical incisions and help minimize scarring. They're even used on really sensitive areas, like skin graft donor sites. Basically, they're the go-to choice anywhere that keeping moisture in and contaminants out is the #1 priority. But while all of that is incredibly important, this technology really shows its power when the stakes are at their absolute highest in critical emergency care. And get this, here is one of its most critical jobs, treating a sucking chest wound. In that kind of severe injury, the dressing creates a perfect airtight seal. Why does that matter? Because it stops air from getting sucked into the chest cavity with every breath, which can literally cause a lung to collapse. So yeah, this little piece of plastic is, without any exaggeration, a lifesaver. Now, occlusive dressing isn't just one product. It's a whole family of them. You've got things called hydrocolloids, which are amazing at absorbing fluid and turning it into a protective gel. Then there are these super thin, transparent films that are really clever because doctors can actually see the wound and check on it without ever taking the dressing off. And of course, there are all sorts of foams and hydrogels, each one designed for a specific job. It's a whole versatile toolkit for modern medicine. Okay, so we've covered the what, the why, and the where. Let's boil it all down to the single most important thing you should take away from all of this. This quote from our source material really just says it all perfectly. Occlusive dressings seal the wound from air and contaminants, retain moisture, and create an ideal healing environment. They don't do the healing for you, they just create the perfect stage for your body to do what it already does best, heal itself. So, if you only remember one thing from our entire chat today, please make it this. Forget that old advice about airing out a cut. The science on this is crystal clear. A protected, moist wound is a happy wound. It's going to heal faster, it's going to heal cleaner, and it's going to heal better with less risk of scarring. Period. So, let me leave you with this question. The next time you get a cut or a scrape and you open up that first aid kit, what are you going to do? Are you going to go with the old school wisdom and just let it air out? Or are you going to grab a bandage that can seal it, protect it, and totally supercharge your body's natural healing process? Now that you know the science, the choice is yours.